people who have developed very high drug tolerance would require a higher dose with time to reach the desired effect. Unfortunately, the effects that the heart, the lungs, and the brain could tolerate, that toxicity threshold did not increase with the tolerance threshold.
So if a person was a benzodiazepine addict, did it take more than 4 milligrams to get them to sleep? Is that correct?
Typically, yes.
And what about 20 milligrams?
20 milligrams of IV?
Yes.
Ativan?
Yes.
That was a very large dose that I have never used myself. That was a very large dose.
It could kill you, couldn't it?
Let's backtrack a little bit as to what you mean by killing. Ativan did not really cause direct respiratory depression or cardiovascular depression. What it did is, Ativan does not cause respiratory depression, make you stop breathing, or make your heart collapse and not pumping. What it does first is it acts on the brain and make you really sleepy. And that brain would be so sleepy it would not tell the diaphragm to breathe, and therefore the patient goes into respiratory apnea, meaning not breathing anymore, unlike some other drugs.
So I take it 20 milligrams could do that?
20 milligrams is a very, very large dose, and it could act on that much faster and bring that effect about much faster. Sure, it would depress the consciousness so quickly, and from that point on, it would cause the patient to stop breathing, for sure.
Okay. So Ativan's very effective for insomnia.
I don't.
Do you have expertise in that area?
I don't typically use sedatives, narcotics to treat insomnia, sir. I use them for procedures.
Okay.
Yeah, like to put in a line. So is it effective to induce sleep for us to finish our procedures? Yes, it is.
Can Ativan be used to induce anesthesia level of consciousness?
Not typically to induce sedation, yeah, but not general anesthesia.
And once you take the Ativan, you're aware of the fact that the half-life in a normal individual would be 14 hours?
IV, yeah. PO was less. It's about 12 hours.
Okay, so, and that means whatever level you get to, it should reduce in half over
that
12
period
to 14-hour period.
Yes.
That's correct?
Yes, that's correct.
So if Ativan was given at 2 o'clock, or say 2 milligrams at 2 o'clock a.m. and 2 milligrams at 5 o'clock a.m., you'd expect it to still be in the system at 12 o'clock, wouldn't you?
It would, yes. We can do the calculations and see what is the expected projected dose. It's going to never be so accurate, but at least an estimate.
Okay. Now, am I correct that are you able to correlate dosages of Ativan, either oral or IV, with particular blood levels?
No, I don't typically check blood level for Ativan, so I won't be able to correlate that.
Okay, so you just look at the number of pills that you give and what the effect is.
Yes.
And you start off low, and if that doesn't do it, you do more.
You do more while watching for side effects, because as I mentioned earlier, with higher drug tolerance, it requires a higher dose to reach the desired effect, but you may pass up the toxicity threshold, and so have to be carefully monitored as we ramp up.
Okay. And do you watch when it's PO per oral as well? We
typically always put patient on cardiac monitor with that thing. But when we do IV during a procedure, yeah, we watch throughout the whole procedure, and we have people to watch, the nurses to watch until the patient fully regain consciousness.
Now, when you are watching the person who you've given an IV dose of Ativan to, what causes you to know that it's taking effect?
Well, our desired effect would be the patient going to sleep and being able to tolerate the level of discomfort that a procedure may cause him or her.
Okay. And when you do it by IV, that effect goes very quickly, doesn't it?
Pretty quick, sir, yeah.
Now, if you do it orally, by mouth,
yes,
with pills, the effect takes longer, doesn't it?
Yes, sir.
And during that length of time, a person's speech becomes slurred, doesn't it?
Yes.
Now, being a cardiologist, are you also certified to use propofol?
Yes.
You use it from time to time?
I used it, but I always use it with certain conditions, with certain personnel, and with certain equipment.
I just asked you a question. You can answer it yes or no. You do use it?
Yes.
And when you use it, how do you tell if the person's under the influence?
You mean, how do I tell that the patient has reached the desired effect, going to sleep calmly so that we can start the procedure?
What can you observe in a patient to determine whether the patient, the propofol is active and has worked?
I was not responding to verbal stimuli.
Okay. You don't talk to him, do you?
The anesthesiologist that would be assisting us during the procedure would be responsible in determining that the patient has reached the state of sedation that we could proceed with the procedure.
When the patient is sedated under propofol, they're not talking, are they?
They're not. No.
And you never hear slurred speech from a patient under the influence of propofol, do you?
Before the success of induction, you could still hear the patient talking. But after full induction, you would not hear anymore. That's what we would want it.
And when the patient wakes up, you don't hear any slurred speech, do you?
No, because it is a nice aspect of propofol that the offset time is just as quick as the onset. So patient typically woke up totally refreshed and not having slurred speech, as in the case of other sedatives such as Ativans or fentanyl.
The onset from initial induction is very quick with propofol, isn't it?
It is quick onset, quick offset.
Okay, so when you mean quick, a matter of seconds, correct? Onset?
It really depends on the dosage again, sir, but the titration protocol is every 10 seconds. Start slow, as I mentioned. Start slow, every 10 seconds gives a little bit more. Yes, it would be within minutes, the patient would be ready for the procedure.
Now, so when you were talking with Dr. Murray, did you make any of assessment as to his demeanor?
Dr. Murray's demeanor?
Yes.
He sounded desperate, and he looked devastated.
You came up, you introduced yourself, asked him what happened, and you could tell at that particular point in time he was desperate and devastated?
During his conversation with me, I was not able to make that impression before I started talking to him.
Okay. But when you talked to him, it was clear this guy's devastated.
Yes, sir.
And while you were talking to him and in his devastated state, he told you, please, doctor, don't give up. Is that correct?
Do not give up easily. Please try to save his life.
Okay. But he didn't recommend this balloon pump, did he?
No, he did not mention those words in particular, no.
Because in actuality, you quickly became aware that there had been no pulse on this patient for over an hour. Is that correct?
There was no pulse. Whether it's for over an hour or not, at that time, I couldn't tell.
There had been no pulse since his arrival at the hospital, had there?
I was not present when he arrived at the hospital. He was taken care of by the emergency room team.
Okay, but before you decided to do anything, you checked with the other doctors, probably Dr. Cooper, and asked Dr. Cooper, has there been any pulse?
That's correct.
And she said, he hasn't had a pulse.
That's correct.
And as a matter of fact, did she tell you that she wanted to call it when he was at his home being treated by the paramedics at 12:57? Did she tell you that?
I only knew that after the fact.
Oh, she didn't tell you that before you started making your diagnosis?
No, sir.
And she didn't tell you that she'd learned from the paramedics at 12:26 that there was no pulse?
No, sir. Actually, I was under the opposite impression. When I was called to come down and assist, I expected the patient to have been, the patient was coding. That's what I was told. That means that resuscitation effort was at least partially successful, and either I had to help with some procedure and get ready for admission to the CCU.
But when you got down there, you saw the patient, there had been no change in the patient's condition since he arrived there in the emergency room?
Since his arrival or not, I would not be able to tell right at that time. All I knew was the patient, by the time that I came down, appeared lifeless. I couldn't find a pulse. My attending couldn't find a pulse.
Okay, now, when you have a patient there that has no pulse, there's no indication to use a balloon pump, is there?
Not typically, no.
I mean, in an ordinary situation, when you come down and you find any kind of a patient, the patient's not breathing and has no pulse, you're not going to use a balloon pump, are you?
No, unless there was a physician or a nurse trained in knowing how to take pulse, such as Dr. Murray, that claimed that he got a pulse. We gave him the benefit of the doubt.
Well, had Dr. Murray, did somebody tell you that while Michael Jackson was at UCLA Medical Center, Murray had got a pulse?
Dr. Murray told Dr. Cruz that he got a pulse.
Since he was at the medical center, he was never even allowed to touch Mr. Jackson, was he?
I was not aware of what he was allowed or what he was not allowed.
Did Murray?
He did.
Well, allow the
Excuse
witness
me.
to finish. You may.
But during the time that I was present there, he did not touch the patient.
And all of the other medical people there said there was no pulse, correct?
Correct.
Now, did Dr. Murray tell you that he felt a pulse?
He told Dr. Cruz.
Who?
He told Dr. Cruz.
Dr. Cruz?
Yes.
Okay. Did he tell him when he felt the pulse?
Dr. Cruz probably did not ask when that was. I learned from Dr. Cruz that Dr. Murray told him that he found a pulse, and Dr. Murray requested that we did not give up on him, so we would go ahead and put in the balloon pump.
Okay, when was it that Dr. Murray felt a pulse?
I did not ask because Dr. Murray didn't tell me. Specifically, he told Dr. Cruz.
Did Dr. Cruz ask him when he felt a pulse? Whether it was an hour ago or 2 hours ago?
Not to my knowledge.
Would it matter if it was an hour ago or 2 hours ago?
In a case of collapse like this, we're not talking about hours, we're talking about seconds, minutes.
So
yes, it matters. It matters very much.
Now, you indicated that you did it. Well, first of all, was it your idea, Dr. Cruz's idea, to do this balloon pump?